If there was a misconception about suicide or misconceptions that you would like to clarify, what would they be?
I think there's two that probably stick out the most when it comes particularly to working with parents. And the first is, if I talk to my son or daughter about suicide, am I going to suddenly make them suicidal? Like the belief is if we have a conversation about this, do I put this thought into their head? It's an unfortunate myth that really prevents people from having important conversations with their children and getting the help that they need. What we do know is that sometimes when we have conversations like that with our kids and they seem like they're depressed or they're withdrawn and we're worried about them, if we ask them if they're having thoughts of suicide, first of all, it's scary as a parent to think about that, but the other piece of it is that for kids, they don't think they can talk about it with you. They're not sure that they can do that. It's stigmatized. They feel a sense of shame and so forth. And so the problem is when we do talk with them about it, if they are having those thoughts and they express that back to us, it isn't that we suddenly made them suicidal. It's we've now given them a safe and comfortable zone to have that conversation, which is, I think, as parents, what we ultimately want to do around any topic with our kids. So that's one. I think the second one that's really important is that when we think about who's at risk for suicide, I like to talk about it as sort of like suicide doesn't discriminate. You can't simply look at statistics and say, well, boys are at higher risk for dying by suicide. That ignores the fact that girls are 4 times more likely to make suicide attempts. So, we want to address the needs of everybody and not necessarily focus on what they look like, how old they are, if they're male, they're female, race, religion, all those kinds of things. It really doesn't discriminate.
And we as a society and as parents there's still such sensitivity about talking about this. People are afraid to talk about it. So what are some of the things that we can do to kind of make that a more comfortable thing? Because it's something that very much needs to be addressed.
Right. Well, the first thing is you have to sort of get over that barrier for yourself. It's kind of like the don't ask, don't tell. If I don't ask you if you're having thoughts of suicide, then you can't possibly tell me that you are, right? But in the same sense, if I do ask, what happens if you say yes? So we have to kind of get past that initial barrier of saying, maybe I'm going to hear something I don't like. But if we're doing it in a respectful